Hi everyone, my name is Med. Last time we looked over primary biliary cholangitis, which some people can get confused with this condition, primary sclerosing cholangitis. As the name sounds, these conditions differ in the tissue, as one is sclerosing and the other isn't. These notes are based on the following resources. I've been using Zero to Finals, the online Scott's Notes PDF, the Oxford Handbook of Clinical Medicine, and utilising the NICE guidelines. As a disclaimer, I am a third-year medical student. This video is not intended to be a substitute for any professional medical advice, and you should always consult your doctor about any health concerns. Let's break down the name. So, sclerosis means abnormal hardening of the body tissue. So in this disease, the bile ducts are stiffened and hardened. Then the second part, anything ending in itis means inflammation. Therefore, cholangitis is the inflammation of the bile ducts. So there's inflammation, stiffening, and hardening of the bile ducts. Let's put that all together. Primary sclerosing cholangitis is a condition that causes strictures and fibrosis of the intra and extrahepatic ducts. Remember, their function is to drain bile from the liver. This causes progressive cholestasis, which is the blockage of bile flow, and bile duct inflammation. So what are the symptoms of primary sclerosing cholangitis? Firstly, pruritus. In a healthy, normal liver, bile acids are excreted through the bile ducts, but when there is restricted bile movements from sclerosis and cholangitis, the bile builds up in the blood, and this causes excessive itching. Next, fatigue. Jaundice occurs because of the built-up bilirubin in the blood. Again, this is due to the cholestasis. Chronic right upper quadrant pain occurs because, of course, this is where the liver sits. And then lastly, hepatomegaly, which is an enlarged liver. Who gets PSC? PSC is more common in men, particularly around the age of 30 to 40 years old. It is particularly prevalent in those who also have a diagnosis of ulcerative colitis, which is present in about 70% of cases of PSC. There's also a genetic component, which is associated with HLA-A1, B8, and DR3. When we want to look into liver disease, of course, we're going to need to do some liver function tests. In the early stages of the disease, ALP may be raised first. Then, as the strictures worsen, bilirubin will raise due to reduced excretion, and other LFTs like ALT and AST can become deranged. In primary biliary cholangitis, it is particularly associated with anti-mitochondrial antibodies, but in PSC, there are no antibodies which are highly sensitive or specific. The main ones which are seen are the anti-neutrophil cytoplasmic antibodies, which is in up to 94% of cases. There's also anti-nuclear antibodies and anti-cardiolipin antibodies. Next to the diagnostic tests, you want to do an MRCP, which is the gold standard test. It stands for magnetic resonance cholangiopancreatography. Lastly, biopsy can be very useful to look at the progression of the disease. This is MRCP, the diagnostic test we just spoke about. It's a special type of MRI that allows you to image the liver, the bile ducts, and the pancreas. In PSC, you see bile duct lesions or strictures. This condition can lead to quite a few different complications. Firstly, it can cause cancer. This could be of the bile ducts, the gallbladder, the liver, or the colon. In fact, 10 to 20% of PSC cases, the patient develops cholangiocarcinoma, so that's bile duct cancer. The patient can also develop acute bacterial cholangitis, which is also known as ascending cholangitis, and is the inflammation of the bile duct, and is regarded as a medical emergency. Of course, the patient may progress to cirrhosis and liver failure, and the patient may also develop biliary strictures and fat-soluble vitamin deficiencies. Okay, let's go over treatment now. It's pretty similar to PBC. We can give ursodeoxycholic acid in order to slow down the disease progression. Cholestyramine is given for pruritus, and it is important to regularly monitor for the complications we've mentioned. You can also do something called ERCP, which is endoscopic retrograde cholangiopancreatography. And lastly, liver transplant may be used in the advanced stages of the disease. This is a screenshot from the BNF. The top dosage for ursodeoxycholic acid, you can give 12 to 16 milligrams per kilogram to an adult and divide it into 3 doses for 3 months. Then you can reduce it down to once daily at night. Cholestyramine in adults is a bit simpler. That's 4 to 8 grams once a day for pruritus. In the treatment section, we've mentioned something called ERCP, or endoscopic retrograde cholangiopancreatography. It can be used to diagnose and treat PSC. As it says in the name, it's a type of endoscopy. It goes through the GI tract, reaches the duodenum where the bile ducts empty. It enters the sphincter of Oddi, which is the muscular valve controlling the bile flow, and into the ampulla of Vata, a small opening. From here, it enters the bile ducts and contrast is injected. This can be imaged with an X-ray, where you can dilate and stent if necessary, which can help with the flow through the ducts and improve the patient's symptoms. Great, let's recap. PSC is a condition where strictures are formed and there is fibrosis of the intra and extrahepatic ducts, leading to cholestasis and cholangitis. The patient may present with jaundice, fatigue, pruritus, right upper quadrant pain, and hepatomegaly. It is heavily associated with ulcerative colitis. ALP is raised in the early stages of the disease, and other LFTs such as bilirubin will become more deranged over time. MRCP is a type of MRI and is the best investigation to carry out for PSC. There are no specific autoantibodies sensitive or specific to PSC. We've mentioned the risk of cholangiocarcinomas and colorectal cancer, as well as cirrhosis and liver failure. ERCP is a type of endoscopy used to image, dilate, and stent strictures in order to improve the patient's symptoms. Lastly, treat with ursodeoxycholic acid to slow disease progression and cholestyramine to help with pruritus. This video was brought to you by Med2Med. If you enjoyed today's video, please leave a like, comment, and subscribe, and I'll see you next time.